Well, remember the Keynote-001 study was a very large 655 patient phase 1/2 study. It morphed into this entity where you had multiple arms at different doses and schedules of pembrolizumab. It was 10 milligrams every 2 weeks, every 3 weeks, 2 milligrams every 3 weeks, comparison of 10Q2 to 10Q3, etc. But at the end of the day, you had a large cohort of patients who were treatment naive. I think it was well over 100. The majority were treatment refractory, had seen other treatments, predominantly IPI and other things. And the 3-year survivals, depending on the particular cohort of that trial, and depending on whether you were treatment naive or treatment refractory, were very impressive. And there was a slight decrement from 1 to 2 to 3 years, but at 3 years, in the treatment naive population, you're looking at over a 40% survival. In the refractory population, it's in the mid to high 30s. Those are very respectable numbers, and I fully expect that there will be a plateau for those patients who received single-agent pembrolizumab on the 001 Keynote trial. And similar to the data that Steve Hody presented at AACR for the original phase 1 nivolumab refractory trial, where there was a plateau from 3 to 4 to 5 years in the mid 30% in refractory patients, I suspect you'll see something similar for pembrolizumab. For the treatment naive patients, it'll probably be even higher. And for the first time, those data, which will show a plateau at a very respectable 30 to 40% rate, suggest that we can start talking about cure for our patients. And the irony is now we have to make some serious long-term plans for a lot of patients. That's a labor of love. I have no problem with that. That's great news for patients. But the BMS-003 data from ACR and now the Keynote-001 data presented at ASCO suggest that we're going to plateau out at a very nice number with pembrolizumab single agent or with nivolumab single agent. And those patients may well be functionally cured.